Health is the most.
You know that feeling? The season starts to turn, a child coughs, and your mind just kicks into overdrive. Is this just a simple cold? Could it be the flu? And if it is the flu, how bad is it really? It's that moment of uncertainty every parent knows, and that's exactly what we're going to clear up today.
So let's get right to it. A lot of us have this idea that influenza B is, just a really bad cold, something you tough out for a week and then you're fine. But honestly, that assumption can be seriously misleading. So let's bust that myth and get to the facts you absolutely need to know.
And here's how we're going to do it. First, we'll get to know the virus itself. Then we'll cover the symptoms and how it gets around. After that, the really crucial part, when you need to worry. Then we'll get into the right way to care for someone at home. And finally, we'll finish up with the best tool we have, prevention. All right, let's dive into our first section. To really fight something, you've got to know exactly what it is you're up against. So, what is influenza B? Okay, so in a nutshell, influenza B is one of the main viruses that causes the seasonal flu. It gives you that nasty respiratory infection. Now, here's a key detail. It only spreads from person to person. It doesn't jump from animals to people like some other flu types can. You might also hear about its two main lineages, or families, called B/Yamagata and B/Victoria. Just think of them as two different but closely related versions of the virus. Now this is a really important comparison. On one side, you've got influenza A. That's the one famous for causing those huge global pandemics, partly because it can come from animals. Then you have influenza B, which causes our seasonal outbreaks. But here's the kicker. Look at that bottom line. According to the CDC and a ton of research, when it comes to an individual person, influenza B can be just as severe and cause complications that are just as dangerous as influenza A. So that whole idea that it's the milder flu? Nope, that's a total myth. Okay, so we know what it is. The next big questions are, how do you know if you have it? And how does this thing travel from one person to the next?
The symptoms probably sound pretty familiar. A high fever, the awful body aches, a hacking coughs, and just pure exhaustion. It's that hit by a truck feeling that really separates the flu from a common cold. And here's a really important note for parents. With kids, you're much more likely to see digestive issues on top of everything else, things like nausea, vomiting, and diarrhea.
This virus is pretty sneaky. It has three main ways to get around. The biggest one is through respiratory droplets, when you breathe in tiny particles from someone's cough or sneeze. The second is just close contact. But the third one is the one we all forget about, touching a contaminated surface. The virus can hang out on a doorknob or a phone screen, just waiting for you to pick it up and then touch your face. All right, everybody, lean in for this next part, because it's probably the most critical piece of information in this whole explainer, especially if you're a parent or a caregiver. Most flu cases get better at home, but you absolutely have to know the signs that tell you it's time to get professional help, and fast. And hey, don't just take my word for it. This quote from an expert at a top children's hospital really says it all. While most people recover just fine, influenza B can lead to some really serious complications. We're talking about things like pneumonia, a severe lung infection, or myocarditis, which is inflammation of the heart muscle, and even encephalitis, which is inflammation of the brain. These are rare, but they are very real risks. So what are those red flags? For kids, these are the absolute do not wait signs. A really high fever that just won't come down with medicine, any kind of trouble breathing, like if they're breathing super fast or you see the skin pulling in around their ribs, if they become hard to wake up, are crying in a way you can't console, or have a seizure, or if they've completely stopped eating or drinking and are showing signs of dehydration. You see any of those, you don't hesitate. You get medical help right away. And we have to remember some groups are just way more vulnerable to these severe outcomes. This includes really young children, especially those under 5, older adults over 65, pregnant women, and anyone who's dealing with a chronic illness like asthma, heart disease, or diabetes, or who has a weakened immune system. Okay, deep breath. We've talked about the scary stuff, so now, what about a mild case that doesn't have any of those warning signs? Let's talk about the best way to take care of someone at home. So for a mild case, the home care playbook is pretty straightforward, but it's so important. Number 1, rest. It's not optional. The body needs all its energy for the fight. 2, liquids. Water, juice, oral rehydration solutions. Push the fluids to prevent dehydration. 3, you can manage a fever with an appropriate medicine like paracetamol, but always follow the correct dosage. 4, stick with simple, easy-to-digest foods. And finally, a simple saline spray can work wonders for a stuffy nose. Okay. I need to be crystal clear about this next point. This is a huge warning. Do not give antibiotics for the flu. Antibiotics fight bacteria. The flu is a virus. They will do nothing to help, and they contribute to the huge problem of antibiotic resistance. And while there are antiviral drugs, they have to be prescribed by a doctor and are usually only effective if you start them within the first day or two of getting sick. All right, on to our final section. We've talked about how to spot the flu and how to treat it, but you know what's way better than treating it? Stopping it from ever starting. The best defense is a great offense. Now, this stuff might sound really basic, but these habits are incredibly powerful. Washing your hands often, covering your mouth when you cough, wiping down surfaces, not sharing cups or utensils. These simple little things create a major barrier against the virus. But if we're talking about the single most effective tool in our entire arsenal, well, this slide says it all. The data is just undeniable. Getting the flu vaccine can slash your risk of getting a serious respiratory infection by up to 78%. That is a massive, massive difference. So you might be wondering, hey, I got a flu shot last year, so I'm good, right? Well, not exactly. And there are two main reasons why you need one every single year. First, the immunity you get from a vaccine naturally fades over time. And second, the flu virus is always changing. It's a moving target. So the vaccine is updated every year to match the new strains that are out there, giving you the best possible protection. So, here's the bottom line. Influenza B is not just a bad cold, it is a serious virus that can have some really dangerous consequences. But the good news is, we have powerful tools to fight back, from smart care at home to incredible prevention. So the only real question left is, have you put that shield up for your family this season?
Health is the most precious gift. If this video helped you or someone you love, please like, subscribe, and share so more families can stay safe and healthy.